Hello, everyone. I think everyone's on board more or less. So it is 7 o'clock my time, but 8 p.m. Eastern. So we're going to get started on this webinar. My name is Tufescu. I'm one of the orthopedic trauma surgeons here in Winnipeg. And it's my pleasure to bring you this first webinar from the Wellness Committee under this umbrella of the COA. You saw the title, it's Building Resilience and Staying Human in Surgical Practice, and it's a discussion with doctors Damien Paton-Gay and Julian Sernik, whom I'll introduce to you and you see on your screen. First off, I don't have any conflicts of interest here, and I will fade away in the background momentarily, but this is an accredited event, so you will have a Section 1 credit assigned to you. Please expect an email in the next 48 hours or so and follow the link, complete the survey to get your certificate, please. Aside from that, if you have any questions that come to mind, please put them in the chat as they pop up, and I will do my best to bring them up to the speakers at the end of their conversation. We'll leave about 10 minutes. There'll be about 30 minutes of discussion between Dr. Sernik and Paton-Gay, and then we'll bring as many of the questions as we can. And this will be available as well as a tape segment on our website. So having said that, let me introduce Dr. Sernik, who's eagerly awaiting here. Dr. Julian Sernik is an orthopedic surgeon and leadership educator whose work spans operating rooms, boardrooms, and mountain environments. He's a fellowship-trained specialist in lower extremity reconstruction. He practices in British Columbia and serves as a clinical instructor at UBC. His clinical work is complemented by a deep commitment to healthcare system improvement, where he focuses on team-based care, access to surgery, and quality innovation. As expert clinical faculty with the Doctors of BC Consultant Specialist Team Care Collaborative, he mentors physicians in building more effective and resilient care systems. Dr. Sernik is also a TEDx speaker where he explored the shared principles of collaboration and decision-making across disciplines. In Beyond Medicine, he's the founder of HELI, which is the highly effective leadership immersion program through which he works with leaders across industries. His approach is grounded in distinctive combination of business, leadership training, quality improvement, science, surgical decision-making, and real-world experience in high-consequence environments. With decades of experience in ski patrol as a resort physician and now as a certified helicopter ski guide, he brings a practical understanding of how teams perform under pressure, where trust, communication, and decision-making are not theoretical but essential. Julian, that's a lot. Please take it away. I'm going to fade away here.
Okay, thanks, team. That's great, Ted. So excited to share this conversation with Dr. Paton-Gay. I have no conflicts relevant to this discussion either. Dr. Paton-Gay is a trauma and a general surgeon, but he's also an intensivist and a transport physician and educator based in Edmonton, which is where I did my residency as well. He has a very interesting background because of his interest both within medicine, but also his interest outside of medicine. So he's interested in mountain biking and car racing and skiing, and he likes to be in the backcountry and watch out because he's a jiu-jitsu coach as well. So a complex individual, and I'm going to let him tell us more about himself as we get into our discussion. So Dr. Paton-Gay, welcome, and thank you so much for spending time with all of us today.
Thank you very much, Dr. Sernik. You can hear me okay?
Perfect.
Perfect. I have no conflicts of interest either. I was saying before we started, I'm entertaining offers, absolutely. But as it stands, no. Thank you. I guess a little bit about why I'm here today. I think that's probably that's where we should start. I had a circuitous route into the medical world, really into the academic world. I had a somewhat, let's call it, tumultuous upbringing. I think there might be a few of our audience members on this that I've met over the years, but things were fairly tumultuous. I wound up not finishing high school off the bat, and that's certainly not an entirely unique thing amongst people in our fields. Um, uh, Back then, though, the nice thing was that you could come back and you could kind of beg your way back in. So the principal said, "Yeah, sure, you can come back. I'm going to give you 1 year to do grade 11 and grade 12." And uh, a bunch of things came together in life, and I wound up with a really high average. Went to university, and it was on after that academically. Um, Wound up doing general surgery and then critical care, and I kind of fell in love with all of it, just all of medicine. And the funny part of it was, I enjoy the day-to-day medicine part. I love the operating room, and I love what we offer people, especially in the operating room. But I love being around people too. And so it's been what a ride it's been. I became the head of trauma for the Royal Alex in Edmonton, and then the head of trauma, or the medical director for Edmonton. And then I became the co-chair of trauma for the province of Alberta. And then this is going to sound familiar to a lot of our audience, and I think this is probably where some of our discussion is going to go. Then I became a faculty member for the simulation education course of trauma, the simulation education training course for the Royal College of Physicians and Surgeons. I was one of the first faculty for that and did that for a long time, flying around to other countries and things. And then a couple of other simulation courses like the National START course. And then I became the co-chair of the National Acute Critical Event Simulation course, which is a Royal College course for all of the critical care fellows in the country, and a couple others. And the reason I say all this is this is a pattern. This is a pattern a lot of us on here have, and we're going to talk about this a little more. And then a couple of years ago, 2.5 years ago, I'd already been thinking, okay, I gotta adjust. I have two kids; they're 16 and 18 now. And my daughter once, when she was about 10, said, "Why do you only come home to tell us what we did wrong?" And I was like, "Oh, I got to start making some changes here," and which should sound familiar to a lot of our audience too. And then I got a cancer. I got an advanced malignancy that's inoperable a couple of years ago. And it was amazing. It was like all of a sudden, late 40s, and here we are. We're staring a shortened lifespan in the face. And, I wound up getting RT and extended medical treatment, and now I'm in a surveillance phase, and we'll see where things go. And it's taught me a tremendous amount about where I'm at in life. And I think where a lot of us are in life, if we could keep going, I could keep going a little bit on this, Dr. Sernik, if you'd like, or if you'd like to sort of nudge that point in a direction, that would be either way.
Yeah, definitely. I mean, I think, all of us that hear a story like that, um, you know, have something awaken in all of us because we are in healthcare, and even as medical students, we are being exposed to all these new diseases. I remember the rule for us was if you heard the disease, within a few weeks of diagnosing yourself as having it, you definitely didn't have it. So I've diagnosed myself with MS and all these other things, and then we're amongst it all the time. And somewhere in the back of my subconscious is always, what if I became a patient? Like, how's that going to be? And so what was that experience like for you? And how did that inform, your approach to managing the first part of your talk, which is all these career balancing, juggling act, really? I mean, what was that process like?
So, it wasn't exactly catastrophic from within me. This is an external event that happened. I was already a little primed, like I said, to make some changes. But the first thing that happens is, in Alberta, we have our medical reports on it's called My Chart. And I thought, oh, this can't be that. And I'm in my late 40s. So I saw my own MR, and the MR was damning, like absolutely damning. I was like, oh, crap. And I sort of fell down on my knees and just went, whew, everything's just changed. And the first thing that went through my mind was my wife and kids, obviously. And then the next thing was my insurance policies. And I ran down to my insurance policies. But the next thing was this incredible uncertainty. So, as a surgeon intensivist, I know a lot of anatomy. I know a lot of physiology. I know the problem that I have, sort of, right? Textbook wise. But what does this mean for my life was the next huge question. Like, I don't follow patients with this, so I don't know exactly what it means for how things look. And numbers don't solve that. Kaplan-Meier curves don't solve that for you, right? They tell you timelines, but that's not the whole story. The whole story is, how am I going to live my life? And what should I be worried about, or what should I not be worried about? Um, as I worked through that a little bit, it dawned on me, probably the biggest thing is I've already won. Like, I'm a surgeon intensivist who flies around in the red helicopter in Canada. And I'm married to somebody I love tremendously more and more the further we go along. Now, I don't mean to flex with all of this. I just mean that maybe I didn't really appreciate where I was before. And once that dawned on me, I got a tremendous sense of purpose. And the purpose is, I've made it. There aren't really any ladders to climb as far as I was concerned anymore. And so I'm here to help people. I'm here to enjoy what I do every day, including the mundane moments. I think I mentioned a story. One of the nurses I work with said, "Hey, Damien, I've got this book you might like. It's on death and dying and uncertainty." And I was like, hell no. If you have one on like small engine repair or something like that, that would be amazing, because I was living this, right? And then she said, "Oh, yeah, I guess you must learn to live every day like it's your last." I thought, no, nothing could be further than the truth. My last day, what a horrible day that would be. Like, that would be terrifying and awful. What I really learned is just really loving all the mundane moments of life. In the field of life that we're sort of harvesting as we go through it, the vast majority of his mundane moments, or relatively mundane moments, making dinner with my wife last night, or sitting at a cafe this morning with my son after jiu-jitsu at 6 this morning, that kind of stuff. And realizing they're incredible moments. And we forget, or we get trained actually not to build those into our lives, right? So people tell us you need work-life balance and you should say no to things. I'm like, really? I made it a damn long way by saying yes to everything. Everybody on this thing did, So
Right.
just telling people to say no, I don't think is really fair. But learning that it's actually okay to be at a cafe on a weekday for a little while, that's actually quite normal in the world, right? But we're indoctrinated out of that.
Sorry, can
So
you
those are
remind
some of
us
the
what a
things.
cafe is?
Yeah, exactly. It's this place. They serve wonderfully flavorful beverages, and you people watch. You just watch people going about their day. It's incredible. And you solve the world's problems over a latte. Yeah. So anyway, that's
It sounds
how
like
that kind of
that.
happened.
It sounds like the beginning of the story was all about adding, 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 adding. So, did you start subtracting once this diagnosis happened? And a crowd
Absolutely.
of us, what can we learn from that process? Like,
Perfect. Yeah.
is there something for us to learn?
So I mentioned, so first off, yes, subtraction happened very fast. Admin roles, gone, like right away. Like, sorry to Alberta Health Services, but their problems became significantly less germane to my life immediately, so those went out the window. And then actually, I came off trauma while I was doing radiation for 6 months, and I didn't go back to the inpatient trauma service, um, partly because I didn't have the emotional reserve to round and be as empathetic as I could be for all the trauma patients while dealing with all of this other stuff. And I thought, you know what? I'm going to not be the person I want to be for these patients if I come back. In fact, I might be quite the opposite, because it's hard. They're all in crisis every day. Sometimes that's why they got traumatized. So I actually didn't come back. And then that little crisis of identity starts coming on. You're like, well, then who am I? Right. And I think this is where it really cuts into what we're going to talk about today is you start cutting back, and some of it feels good and easy. I got rid of that section head position at my hospital or whatever. And you know what? Somebody else can have that. But then you start cutting into some of the things that you're doing with that build into your identity. So earlier I mentioned work-life balance, and it was actually about 10 years ago before all this that I started thinking about this, but I don't use the phrase very much. I don't love it. Like, I don't need more yoga classes, right? I don't need more other stuff. I don't have to stuff life in. I started learning that really it's work-work balance, right? How much can I accomplish at work realistically? And how much do I need to fill the various buckets in my life? So one of them is identity. Identity is really important. Mastery is really important. Autonomy. There's books about all of this, right? What are the motivators? Drive is a wonderful book about what are our motivators, our intrinsic ones. There's some intrinsic motivators. You know, I got to work too for money. That's okay. The vast majority of the population just works to make some money. There's nothing wrong with that. But then I started learning that there may be some other ones, right? I might have some somewhat pathologic things that I've been working at and adding into my work life over the last bunch of years. Maybe I felt like I wasn't going to be taken as seriously if I didn't do this role or that role, or maybe there was a group I wanted to be part of that does these roles. And so this has got me really thinking about this. And that's what we talked about when we were talking a couple of weeks ago about, you know, how do we subtract and where do
Mm.
we subtract?
Is there a quick and dirty way you can give us to figure out what to subtract?
Yeah, I sort of came up with this principle actually even before all these events, but this solidified it for me for sure, the cancer and changing things. So a lot of people will tell you, or you know, books and things will say, write down everything you do and then write down why you do it. Then you could just decide. What I learned is that I actually did this. So I did this on stick-it notes. I wrote down in pretty granular form all the things I do. I teach jujitsu in the mornings. I train in the afternoons and evenings. I operate on call as a general surgeon. I do clinics. I've got a complex abdominal wall reconstruction practice. I do ICU. I do fly in the helicopter. I'm on the set course, start course, nationally. So like all these things. And then there's dadding, right? And there's husbanding and there's training our dogs and I ride horses and like you said, I spend a lot of time in the backcountry. I love skiing. There's something we share is just being at 3,000 meters in the Rockies and just having cool air and dry snow is just so amazing, right? I used to race cars and I love my motorcycles. So I had all these things. Anyway, I wrote them all down. Next to those, I put a stick-it note for why I did them. And I just left it. And I left it for a few days. And when I came back and looked at it, I didn't feel that I was being entirely honest with myself about why I was doing all these things. And so I redid it. I wrote down the actual reasons I did all these things. And I think that the first thing you write down is actually the thing that you're telling yourself to sort of protect your own ego a little bit about why you're doing it. And some of them are very, very good reasons. Some of them are remarkably pathological. And it becomes very clear which ones we should start jettisoning and which ones are necessary.
What's an example of a pathologic reason that you would identify and say, that's not a healthy reason to do something?
Yeah. So I think sometimes we we work on climbing ladders and we're not really clear about why we're climbing each ladder. So this is not to attack any specific ladder for sure. Because I have colleagues that are climbing the academic ladder in the tenure track. And this is what they love. My sister-in-law runs a big lab in Atlanta. She's a big virologist. It's kind of hard in the States right now. But anyway, you know, and this is what she does. And this is what drives her and motivates her. If her stick-it note next to this would not have a pathologic reason, right? For me, I suspect it would have a very pathologic reason. It would have something to do with, well, I have this deep need to be accepted by academic peers at the university. Okay, maybe that's okay, or maybe that's a problem. Why do I have this deep need? Well, I want to prove to them that I'm good enough. Well, okay, what is that going to get me? And are they ever going to hear that proof? Honestly, most of the time, they're not going to hear it. The Chinese proverb, you wouldn't care so much what they thought about you if you knew how little they did, right?
Yeah, that's right.
You know, so that would be a great example of one.
Yeah. I remember somebody telling me once, you've got to be careful about climbing ladders because sometimes you'll get to the top and you'll realize the ladder was against the wrong wall.
Yes. And it's a lot of work to get up there.
Right? But you only realize it when you get up top.
Sometimes you see people who are quite embittered as they approach the top of that ladder. I bet lots of people on here would feel the same thing. They've met people in surgeons' lounges and things that climbed some of the wrong ladders, or they're in the process of doing it. So I think being very clear with yourself about, again, back to work balance. What are the elements of my work that I do for money? What do I do because I just enjoy the day-to-day? Like, let's not pretend for a second that general surgery and on-call general surgery is a piece of cake and you love it at 3 a.m. when you're elbow deep in poop trying to find the end of the colon in someone's abdomen. There's some downsides, but and the office paperwork's not fun, but that comes with it. You can eat that, right? So I found that tremendously valuable, and I think I would really suggest people try it out.
Yeah, I mean, the subject we're sort of dancing around is all these things called burnout. Everyone's talking about burnout. But you have some unique insights on burnout versus fatigue. Let us in on the insights that you've got from your perspective.
Sure. I actually had a wild conversation with my 16-year-old daughter about this the other day. She was manifesting signs of burnout, and I told her outright, I'm a pathologic overachiever, sort of hoping I'll be happier with myself if I just do more of the stuff. And the busier you get, the more you hope you can sign on to and make it go away. It doesn't work. She laughed and said, "I'm proud of you." And I was very puffed up. But fatigue is wonderful. Fatigue is hopefully comes from type 2 fun, but it doesn't always, right? Type 2 fun is what we do, right? It's skinning up the side of a mountain in the wind and the sleet and knowing that it's hard. And then maybe you get some wonderful turns out of it. Maybe you don't. Maybe you just get a beer at the end of the day, which happens not that infrequently. You go up, you dig a snow pit, you say, "This place is dangerous, I'm getting out of here." And you have your beer and you say, "Damn, that was hard." Fatigue gives us the feeling that we want to break. We want to get down. We want to see our friends and family. We want to have that beer or whatever we're going to do, or see our dog or go on a vacation. And it comes with work, which might not be super fun work sometimes, but it's stuff that's got to get done. Burnout looks very different. And this is where I think a lot of people would recognize this once we say it. Some of the symptoms of burnout. As a medical leader, I had to talk to a lot of people that behaved in very weird ways. They found themselves behaving in bizarre ways in the operating room, snapping at things that they wouldn't normally. They would bring that home. You might be upset with your pet more than you were happy you were, or with your spouse or your kids. You tend to start avoiding things. So if you're in a leadership position, you'll notice that you're not answering those emails anymore. Your email box grows. Mine grew once when I was really suffering for burnout to 3,000 unread messages over the course of a couple of weeks or a few weeks. Right? That's what happens in all these roles. And you get this very avoidant thing. You got to do them. And the interesting thing about that time actually is if somebody had asked me, "Well, you got 3,000 unread messages. How long did that take to accumulate?" I would have said, "Whoa, that's crazy," because I checked it like 3 days ago. But I hadn't checked my email in weeks, which for somebody in an active role is crazy, right? That is, arguably unprofessional conduct that like maybe you shouldn't be doing the role. And rather than attack the people in that position, I've really learned like we need to explore where their life is at and where their work balance is at. We also, a great sign, or like a very important sign of burnout is somebody will say, "You look burned out, you should take a break." And all you can feel is contempt, right? You have this incredible feeling of contempt towards them. You're like, "What are you talking about? I should take a break. That's not going to make things better. I'm going to feel so much worse if I take a break." That's like telling somebody who's a tired swimmer with their nose just above the water, trying desperately to be like, "Well, you're really tired. You should just stop paddling." Like, right? So those are some of the symptoms of burnout. And once you think about them, they're so different than fatigue. It's incredible how different they are, right? Even sleep at night starts feeling like a burden because you're like, "Oh, I got to get stuff done." And then once you notice you start adding extra things on or making promises that you're probably never going to keep, you stop actually working on any of it because you're not going to get it done. So when that happens, you're already very deep. And what I'd hope for people is getting a bit more perspective on their work balance and how much they're doing would allow them to start recognizing those symptoms earlier and take away some of the fear of shaving down. Start identifying things that you can shave. Everything you take off is going to hurt a little bit. It's going to be a bit of a cost. But if we start recognizing, okay, I'm starting to feel this. I'm starting to see my inbox go up. I'm starting to feel a bit contemptuous towards work, towards other people, or people that tell me I need a vacation. Screw them. What do they know? Oh, it's time to go back to my stick-it notes. We're going to have to peel another stick-it note off here. I don't need to go to yoga. That's not going to solve it. That's just like taking a vacation.
Yeah, no, for me, I think some of the burnout comes from being embedded in teams that are not functioning well. And so, if I'm tasked with doing, say, an operation or being on call, and then the tools in my hands are people that don't belong on that team or can't function on that team, that becomes exhausting on a deep emotional level because you've got the responsibility, but you don't have the tool to do the job.
Absolutely.
And in my brain, I've got these sort of rules for energy spending. If someone says, "Hey, do you want to be on this committee, or would you like to help us with this group effort?" My rules are sort of, well, first of all, do I love the thing? Is it good for me? Those are different things because there's a lot of stuff I love that isn't good for me. Am
And
I
vice
excited?
versa.
Right? Am I excited by the idea? Because some things are sound pretty fun and they're good, but really when you think about it, you're honest with yourself, you put your sticky note there, you're like, it's not that exciting for me. I got lots of offers. I don't really want to do that. So it's gonna be fun, it's gonna be exciting, it's gonna be good for me. But most importantly, the team that I'm joining has to have the goods to get the job done. And so I find when I'm embedded in a team that doesn't have the goods to get the job done, that's exhausting for me in some deep emotional level. I find myself withdrawing. And so now that we're sort of talking a little bit about teams, tell us a little bit about what you've learned about team dynamics and communication, and the contrast between this cognitive task alignment and information overload. Can you give us a little bit of a whirlwind in those areas?
Yeah. So I really love, I think similar to you, I love teams in crisis in the acute setting, right? That's one side. And in that one, I could swallow some of what you were describing. In fact, on the ski hill, we both had these. I've had multiple crises on ski hills, or in the backcountry where the people around me are not medically trained, and we've got to deal with unconscious patients in the snow with bleeding airways and that kind of stuff. And same with the helicopter. We land at places where with teams that are completely unfamiliar. I actually kind of revel in that part because I know that I've got me or a couple of people who can get the best out of that team. And the challenge of trying to get the best out of that team in the moment is really interesting. But man, day in, day out, ooh, that gets tricky. And I think a lot of people on here could probably empathize with the operating room where people are changing over all the time. And how are we going to manage this? Yeah. I'm not sure that I have a perfect answer for this. I mean, we can't just walk out all the time. And storming into the manager's office, I'm sure many of us have done that. I certainly have. I've gone in quite loudly on a few occasions. I've had some principal visits for the same thing, and it's really been quite fruitless. So, uh, you know, trying to gird ourselves to turn it into that acute setting as much as we can, where our communication is extremely directed. We stay disciplined about pre-briefing and ensuring that before the day is gone, we've determined what everyone's skill set is, what our plan is, and everything. And developing an environment where we are the most likely to keep people around us for as long as possible. I think sometimes those frustrations boil over, especially in the setting of a bit of burnout. And then we start contributing to that changeover, which is a massive danger, right? And I've been invited to speak at other hospitals where this has been a big issue, where the changeover has gotten insurmountable and the frustration has self-cycled, right? Have you got some add-ons to it?
Yeah, I mean, yeah, for me, I think uh, there are experiences you can have during your training, which alter your ability to take care of yourself. And so the big ones for me, like ironically, have been the education pieces where I've gone and spent some time at business school, I've spent some time in a leadership course, and then I've circulated with people from totally different industries. And it's shocked me and actually humbled me because you tell yourself these myths like orthopedic surgeons are the hardest working people on the planet. And you know what? During some of our lives, we really were. But then like for me, I meet people in other industries, like the classic one is the ski guides, who work so hard. Like when I go do a week at heli skiing, I'm so completely destroyed in a week. I almost can't get through. Like I can't, it's almost hard to get through 2 weeks of it. And then I go back to my like ortho trauma call, and it's actually a down for me in output. Um, and it's just different kind of work. You're on customer service. You know, my background, I had bartended for a while and ski patrolled for a while. So it's like bartending and ski patrolling at exactly the same time. You're customer service, you got to smile, you're entertaining guests, you're also trying to not kill people, and you're trying to make sure the helicopter doesn't chop heads off. I mean, it's like there's so much stuff going on. And it's, 17-hour days where you're really on. And so I come back to my work in orthopedics and I think, you know, wow, there are people working so hard for so little. And I feel this tremendous gratitude when I walk into the operating room and I say, well, there's the anesthetic doc, there's the three nurses, there's my assistant, all these people, the whole recovery room is waiting for my patient. Everyone is surrounded there really to let me do my job in a way. I mean, that's not the only reason they're there, but really, what an incredibly amazing environment to be inserted in. Like you said, in Canada, you're in a first world country doing this kind of work, helping people, and I feel so grateful. And so for me to step out into other environments and then come back is really perspective generating for me. Um, at the same time, when I go and I talk to other companies or I spend time in business school and I hear how things are run, then I look at our healthcare system and I'm like, wow, this is almost like a design to make me freak out.
It
And
is.
and there's so much to learn in other industries but we have so much to learn medically. We really don't spend a lot of time, in leadership studies and how to, and putting teams together and things like that. So it sounds like you for sure have in your roles. Um,
Yeah, I think I might add on a little bit if that's okay.
yeah, tell me more.
I think so I say this all the time. I think people get sick of me at 2 in the morning and I'll say, you guys stop just for a second. We're listening to music in the operating room. We're cutting a big hole in somebody. We're going to make them better. We're going to extend and ameliorate their life, certainly from where they are at 2 a.m. in the operating room. And I'm doing it with people that I care about a lot. And I have a tremendous respect for, even if sometimes they're grumpy or sometimes they do, frankly, a so-so job because that day they're not on. And I get paid pretty handsomely for it. I and I enjoy tremendous social privilege in Canada for doing all this stuff. I mean, what an amazing opportunity. Out of all this too, I've got this great big CV, which is now given me the opportunity to go to other places and do stuff. And so one of the hard things is actually just recognizing that, we do have mobility. We have mobility within our job, and we have mobility to other jobs. And you said it really well. Experiencing other industries or other areas of life is such a massive part to remaining happy and having longevity within our career. And to do that, we have to allow ourselves, we have to convince ourselves that building a bit of elastance or a little bit of plasticity into our life is safe, and it'll be okay. Couple things I'd like to say about that it's going to be okay. First off, the people watching you, we got indoctrinated when we were residents that everybody's watching you. Every day is a job interview, and it very much is if there are residents on here. I mean, let's be honest. Like, I'm interviewing our residents every day. So it is. But as you get out, fewer and fewer people are interviewing you. And so we could start building a little bit more life in. And in fact, we're going to do better on that day-to-day interview if we come with a broader scope, a broader view of the world, and a little more gratitude with where we are when we're here. So you can't just tell people to be grateful. They can have tremendous life-changing things. I've had a couple of them. Um, you can also build it in by seeing some more of the world. And it doesn't have to be medical. It can be. But trust yourself that adjusting or shaving a little bit off your identity to go out and build some of this into your life is actually going to be worth it. It might even cost you some money. Crazy. What a crazy thought. My friends in finance would be like, why would you do something that costs you money? Well, it turns out that field of my life that I'm sort of cultivating as we go through is not all of it is all expensive stuff. Some of it's really inexpensive stuff, I love my backcountry skis and skins. I go to town when I buy that stuff, but it's not that expensive. And then from there on, it's just go out and find trees and snow. That's my whole goal. So, yeah.
Yeah, I mean, to me, sometimes you can put this in a framework of the opportunity cost. What's the cost of not doing some of these things? And I think, in our career, specifically in Canada right now, I think there's real pressure to stay on the narrow track. Just for me, it's, hips and knee replacements and fixing bunions, and there's just the wait list is gigantic, and the hospitals calling me saying, "Can you pick up OR days?" And the people are asking me if I could do a bit more call, and the office is asking me, "Hey, can we schedule another office day here or there?" And the wait lists are all up, and so this, and then then you've got your financial pressures. If you've got a financial planner, they're saying, "Well, here's your 18-year plan left," and you're like, "But I'm 50." What? And they're like, "Oh yeah, you're never paying your house off. You're going to work forever, and that's fine." And so it's really hard sometimes. The pressure to stay in your narrow focus is so high for some of us. And I think as a result, some of us may be missing out on these glorious events where you step out for just a moment. It doesn't have to be a long time. Even just stepping into someone actually else's OR to watch them operate. I did that recently. It was
What a
great. It
joy.
was it was one day, and it actually built so much into me. Not just the tangibles, like yes, I watched another man operate, another surgeon operate, and that was great because I don't do that a lot, haven't done that a lot of years. But it wasn't just that; it was also watching another person go through the process of wearing the same hat that I wear, and seeing the differences and recognizing the things that I could learn from that. But then stepping out of surgery and going to a different industry, when I come back, the insights, the perspective. It's why I guess why it's why people travel. Although,
Yeah.
every time someone says, "Oh, you should travel to Spain and go see the foot and ankle guys there," or whatever. I did last year. I went to Australia and spent 10 days with a guy down there, and it was so good for my career, like my longevity, and also I hate using the word resilience because it's just so
Yeah.
overused. But I guess it made me a bit more stable, and it made me not worry about the things that I thought were perennial problems. Like, money is a perennial problem. But I
Yeah.
found in myself when I'm most unhealthy,
Hospital
I,
management is a perennial problem, right? I'm not going to solve
yeah,
this. Like,
no, but I whine and complain and feel that pain way more when I'm not spiritually sound. So if I go into another environment, even for 12 hours, I come back and I've stopped worrying about those things, which is fine because worrying doesn't make any of that better anyway.
totally. Two quick points because we're going to go on to questions right away. The first is just to touch resilience really quickly. Resilience, we conflate resilience and toughness, right? Resilience is not toughness. Otherwise, we just say toughness. Toughness means I can take on everything and nothing will ever hurt me. Resilience means I'm not there to actually be injured, right? Or if something does injure me, I'm able to get back up. That's a completely different thing than just straight up toughness. And uh, so I'll leave that with everybody. And the second thing is, thank goodness women are teaching us this in the surgical world, right? I had a surgeon once tell me in front of one of our female residents way back about 15, 20 years ago, he said, Damien, if you take a week off, you should be careful. You'll be all thumbs when you come back. If you take 2 weeks off, maybe book minors for a couple days and then get back to the OR. If you take more than 4 weeks off, this isn't the job for you, Damien. And he looked straight at her. And it was very clear what the statement was there. And you know what? We have tons of women now in surgery, and it's amazing. Our programs are half female, and they're going away for 6 months or a year of mat leave, and they come back and they kick ass as surgeons still. And they come back with often a lot more perspective on life, and we're learning from them. And there's so much for us to learn about resilience and a broader perspective from them. And it's such a huge benefit. We need to appreciate that. So that's the end of my points, and I'm ready for questions if you've got any more.
I like it. Maybe we'll see if Ted has harvested some questions from the chat. Ted, where are we at?
Gentlemen, that was fantastic. You have answered all the questions because I haven't harvested any, but I do have some questions, and I will say this to the audience. I think would it be fair to just ask everyone to just put a hand up if they have a question? Would you guys be okay with that?
Yeah, that sounds perfectly
Yeah,
fine. I
absolutely.
I'm going to take moderator's prerogative while we wait for hands to go up. I want to ask a question that's been on my mind, which is, okay, so we've gotten this perspective from you, Dr. Paton-Gay, about, a diagnosis, a reframing, and something that we can all learn from that. So somebody listening might say, well, that's all fine, but I don't have a diagnosis. So what if disaster never strikes? Are these perspectives, are these mindsets, are they still valid? Or does this apply to me still? Like, what's your perspective there?
Yeah.
That's a
So
great point, Julian. Sorry, Damien. I was
yeah,
actually going to ask the same exact question because I think, Damien, you mentioned that was a trigger, this big life moment that sent you down to this analysis of what was important to you, labeling everything, and then subtraction and reorganizing things. But what triggers, how do we get out of our day to day and start down this process without a big catalyst or without recognizing a big catalyst? That was,
yeah.
if you're treading that water and trying to get that oxygen, how do you get out of that moment gently and go down this path?
So I love that. I first off, look how many people are here. Like we had a lot of people here watching, and the title really gave away of what we were going to be talking about. So I think that probably at least the title seemed germane to a lot of people, which I think is telling. Um, the you know the initial steps I think can start with looking around you. Where are you spending your time? Are you spending your time in the surgeon's lounge? How are you feeling when you're in there? What are you working on where you're sitting back and saying, I shouldn't be here right now? We didn't talk about this actually. My other pastimes over the years was playing poker. I used to play a lot of poker. And an interesting thing happens when pretty much anybody that plays tournaments or a lot of poker will tell you if you don't feel like you should be there in that moment, if you feel like there's something else you should be doing, you will lose your stack faster than you can even believe because your brain will scuttle the activity. So when you're doing things, let's say writing, if you're writing a chapter, you're working on a presentation, and you're finding that activity is getting scuttled, and you're finding you're feeling contemptuous about the fact that you're there, or you start developing some signs and symptoms of burnout, if we're really honest with ourselves about what those are. These are times where we can light that spark by, again, going back through what are we actually doing in our work? What's our work balance look like? Again, I don't think we need to chase after um, uh, work-life balance by adding more life. I think first and foremost, let's just think about what we're doing at work. So those would be the things I would suggest. Listen to your family. There's a really good chance somebody said it. Sometimes I think we got trained to revel in it when people say, wow, Dr. Paton-Gay or Damien, because my family, you work so hard. I'm like, yes, I do. Because that's what we did in residence, right? Damn it, I work so hard. Give me a job, please. Would you please give me a job? And so uh, if we find ourselves sort of feeling like, I feel wonderful that I'm the hardest worker in the world, you go out and see some people do it. Watch a mom. Like, honestly, just watch a new mom. Like, if we think we work hard in surgery, you just watch a new mom. And so recognizing that, um, and, uh, and when people bring it up to you, are you really enjoying that fact? Maybe it's time to reassess.
There is a question from Dr. Sukdeep Dalai. She entered it in the chat, but she did have her hand up.
Yeah.
Dr. Dalai, would you like to just maybe state your question?
Sure. Thanks so much for this very engaging webinar, actually. I have a question. Professor Michael Unger, he's a social worker who works out of Dalhousie University. He's a renowned expert in resilience. I think in the chat it said resident, but should we say resilience? Defines workplace resilience as the adequate provision in the workplace of resources necessary to achieve good outcomes in spite of serious threats to adaptation or development. And I think a lot of us feel that that isn't healthcare in Canada right now. Can you give us some thoughts about what individuals can do to move the needle on this and feel like they have agency in the workplace, and that I know, like we can drop responsibilities. I agree with that, and we should be mindful of that. But what about the work that we are doing? How do we feel like we can have some control over what is happening to ensure good outcomes for our patients?
Wonderful question. Thank you. Yes, so we talked a little bit about resilience at the individual level, and then there's resilience in the team level, and then there's resilience in the greater organizational level, like the actual company, right? Yeah, Dr. Unger's work is certainly well known in the area. So, what can we do? One thing is we can be very overwhelmed, and I did this a lot. As the chair of trauma for Alberta, and running a zone and a hospital and trying to meet with everybody and do and solve everything, you can get very, very overwhelmed. And I'd like to bring up two companies. One is Grumman. Do you know Grumman makes canoes, and they make gliders, and that's it. And you'd think that a company like Boeing that makes giant jets and everything could make better gliders because they do more complex stuff. But they actually don't. They don't make better gliders. The company that just makes really good gliders does it the best. And canoes, they make phenomenal canoes, right? This is like, what a simple boat. You'd think a company that makes big complex motorboats would make better canoes, but they don't. Nutella. Do you know what other products Nutella makes? None. They don't make anything else. They make billions of dollars, and they make the best damn spread in the entire world. And they have never made any other product in the world. And I think everybody loves Nutella, I think. And also as a company, what a cool thing to do. The reason I bring those up is we got to recognize that we all have a Superman complex in the medical world, right? One of my colleagues, his wife, he's a surgeon, and his wife is a PhD in psychology, I believe it was. And she calls the MD the magical degree, because all of a sudden you're Superman when you get your MD, or Superwoman. You can do everything, and we can't. So we can't take all this on. So I think a really important first thing is recognize that we have a role to play in all of this, but we can't solve it all. Pick projects, pick reasonable amounts of tasks, work very hard on those, and become expert in those. Beyond that, go through your stick-it note task and see why you're taking on these other ones, right? I know that I was the chair of the Infection Prevention and Control Committee at my hospital for a while. Like, really? I mean, I kind of got roped into it, but I also said yes to it. And so there was a pathologic one for sure, and that I jettisoned. But so look into, why am I taking these other ones on? And I certainly don't mean we should abdicate our role in stewards and leaders in the healthcare profession. I think we have a critical role. In fact, I'm terrified by the lack of physician leadership in management of hospitals and healthcare in Canada. I think it's really dangerous. But it doesn't mean we all do it.
I think that's a really good answer. But I was giving a talk a few months ago, and it was on trust. And one of the participants asked me, "Can you give us a quick answer? How do I improve the trust in my health authority?" And I was like, "Okay, right to it." So my answer to that is also my answer to how do we do resilience better, which is that you have to make sure that your sphere of influence matches the sphere of responsibility that you're taking. A lot of what we do is, if you really write it down and you drew a diagram, you're like taking responsibility for things you just cannot and never will be able to control. And so I really try to align my realistic sphere of control to my realistic sphere of responsibility. And the best place for me to do that, where it really overlaps, is in my office. Most of us have offices, and a lot of my work is focused on how do I make that nirvana for me and for my patients and for what I think is the right way to do things. It might not be the right way for everybody, but it's my way, and it feels good to me. And so that's my little bubble. I created a little bubble in my office where everyone that works there is hired by me. and I control how we do things. And if you're going to come to the hospital and whine about the team that you're on there, make sure that you've got the street cred. Go test it out in the office. See, can you actually lead a team effectively? Learn how to do that well. And then when you come to the office, that'll help you. Sorry, when you come to the operating room, that'll help you because now you're on a team that you didn't assemble. It's often ad hoc, like 5 minutes before you cut skin. They go, here's your nurse. And you're like, oh, that's from urology. Okay, that's going to be a tough one. And they say, as you're gloving, they say, hey, doctor, don't yell at me because I've never done this procedure before. And everyone's heard that. And like, oh, why would they say that to me right before I'm operating? And so all these little stresses that you have, go invest in a team that you can, if you can, that you can really take care of and make it good. And that will give you a lot of resilience when you go to a team that you can't control. Plus, you'll realize, what you shouldn't take responsibility for. That's my answer.
I think you both talked about sticking with what the expertise is and ought to be for oneself, recognizing what is outside of that sphere, as you put it, Julian, kind of defining, where you should, hone in and focus and what battles you should fight. Sometimes these days, it appears to me that sphere that is true, that is our own of expertise gets kind of stretched out over time and invades other parts of our day. There's a very practical question, really. There was a meeting I was at, which is an education meeting. So there was residents and program directors, and this had to do with an app which is used for paging in our site, and you can't really turn it off. So I think the three of us probably had a pager. I know I did. I'm sure you guys did. There's enough gray in your beards. And so you had the pager, someone would send a number and you would answer it. But if you're off call or not working, you would put the pager away and be off. And the switchboard person would know that there's someone else who's assigned to cover that. So the issue came up at this meeting with this app. What do residents do when these trainees do when the messages keep coming beyond their shift and when they're supposed to be post call and doing other things? And some residents had an issue with it, but the ones in the meeting just kind of say, I just leave it on and it's okay. I want to be helpful. It's my duty. It's my job, right? I don't know if that's that toughness you were talking about, Damien, versus resilience. Can you speak to this? What should I say to those residents?
Yeah. You know what? I'm going to throw mine out there, my answer to this out there. And this one might not be the most popular answer out in the world in today's world, but one, I don't want the meritocracy of residency to be built around who's willing to tolerate the most interruption in their life. However, somebody who's going to start a new business needs to jump into that, and they need to make that happen. And they need to be clear with themselves about why they're doing this. Is this what they enjoy doing? And is this where they're going? And to make that work, they've got to jump in. I started new trauma services in Edmonton, and there were only a couple of us to work on them. And we were working, essentially 1 and 2 call for a couple of years. And these are realities in life. Now, where it became pathologic is we said, well, he's a good old guy. He always answers his pager, so we're going to hire that guy. And a lot of that guy wound up being really pathological people that we then married for the next 40 years. And as we can all say on here, divorcing a colleague is the hardest divorce. Well, it can't happen. Not that I have experience with divorce, so maybe I should be careful. But anyway, so I don't want to remove the sense of purpose that people get from their job and tell them, no, never do that. You're bad for doing that. I would like to encourage them, though, as Dr. Sernik talked about, trust. I would love to encourage them to build some of that into creating a team with their co-residents, and so that they know that this is dealt with. And they get the same satisfaction out of being certain that this is going to be dealt with well. And if it's a really big question and I'm the only person with the answer, somebody can call me. But once we've got that comfort level, then we could derive a lot of the same satisfaction out of knowing that we've built that team. And that would be a very high level performance from a resident. I would be like, wow, that's really impressive. When we're in the backcountry, I would say exactly the same thing. If you're going to leave somebody as the tail guide to go find other people that might be in tree wells, you need to trust that person 100%. I can't climb back up and go find people, right? Not easily anyway. So that's what I would suggest to them. I would suggest it's a wonderful thing. If you truly, genuinely get that satisfaction out of it, that's great. Let's work on some maybe more long-term sustainable ways that we can get that satisfaction and know that everything's taken care of.
Very thoughtful answer. I like it. Oh, there's another question for Dr. Delay.
I just have one other question for you. You became ill and you decide to scale back. And sometimes people worry about how they are going to be viewed by their colleagues. And you kind of alluded to that when you were speaking, and I think, you especially when you have been told that residency is a 5-year interview and that's how you were brought up, is that you're being evaluated by everything that you do and every decision that you make. And then you start practice and you think, okay, I'm sick, but can I cut back without being viewed as lesser of a surgeon? Can you talk about your experience with your colleagues when all of that went down, and how their reactions were compared to how you perhaps perceived they were going to be?
Yeah, thank you very much. Actually, that's a great question. I haven't been asked that yet. And so, first off, I was amazed by the level of support from my colleagues. It was very swift, and there was no insinuation that I should be doing more than what I was doing. I was sheltered a lot by a lot of the coverage issues that came up because there were weeks on the trauma service that needed to be covered and things. But and during radiation, there's no way I could have done full weeks on the trauma service like that. Radiation's hard. I just got to tell you, especially your pelvis. Holy crap. You do a lot of hematopoiesis in your pelvis. I found out all my blood counts were horribly low. So, I was amazed by the amount of support. Also, talking about organizational resilience, I don't want to make this too dark, but we've all seen colleagues leave that were giants in our hospital. And then 6 months later, the new people have already started sprouting up, and the new people don't know them. They don't know their names anymore. And even the surgeons that were here for 40 years, and they were the person, they were the one you went to. And then the new people start not knowing them. So I think that rather than a fear of what my colleagues were going to feel about me, because they were nothing but supportive, there was a little bit of a fear of that becoming obsolete and disappearing. And am I okay with that? And that's really, I think it really points to some of the talk about personal resiliency. So remember, resiliency is not getting that feeling on the nose and being tough about it, being like, well, I don't care. They don't need me, whatever, screw them. Resiliency is being like, okay, I see a much bigger picture in the world. I've got a lot of purpose in other areas of my life, and I'm not leaving the hospital altogether, but I'm going to trust that I still have a place in this world, despite leaving some of this. And so I say that to highlight that you have to give some thought. What are we feeling? Are we feeling that they don't respect us anymore? Which is unlikely to be the case, to tell you the truth. It really is in real life. There might be some groups where that is the case, but it's probably a lot less than you think. And am I conflating that feeling with, oh, am I becoming less relevant? And how do I deal with that? I'm kind of a holy shit guy for the hospital, right? As an intensivist trauma surgeon, transport physician, I get paged overhead to emerge not that infrequently for surgical airways, massive bleeds, partial amputation, stuff like that, that I'm really comfortable with. They like having me there. I got called stat to the women's OR because they had a iliac artery torn off. And it's not like somebody, they call Dr. Paton-Gay, which is kind of cool. Like I'm sort of a little puffed up by that, right? But I can't live like that for the rest of my life. So if my identity's built into that and I'm worried that they're not going to like me because I don't do that anymore, it's going to be a really tough time for me and no one else.
Well, thanks very much, Damien. That's a great place to maybe start wrapping things up. See, it's 8:01. I don't know if there's any final words from yourselves. I do want to say thank you to you, Damien. You took us through your journey and taught us a lot of great points along the way, and you were very forthcoming with all of your experiences. So thanks for being here tonight. Thank you so much.
Thank you very much. What a pleasure. Dr. Sernik and I talked a couple of times, and we spent a while on the phone a little while ago just to make sure that we kind of had an idea who each other were before we came. And that was an absolute joy too. If I can help out anywhere I can, I'd love it. Thank you.
Yeah, it was a great conversation. I really enjoyed having that with you today. So thanks to the organizers for putting us all together.
Absolutely, and I'll put a plug in for Dr. Julian Sernik, who's going to speak to us again in June at the COA. So I'm looking forward to that as well. That was a great conversation today, Julian, and thanks for facilitating that and sharing your experiences as well along the way. And thanks to everyone for joining us, and have a good night. Take care.
Thank you. Good night.